like to invite Professor张峰义to the stage, who is former Vice Superintendent of TR Service General Hospital, to introduce our third speaker. Welcome, Dr.张峰义.
Thank you. I would like to introduce the next speaker. The next speaker is Professor Liu Poyi. He is now the Director of Divisional Infectious Disease Department of Internal Medicine, Taichung Veterans General Hospital, and is also the Adjunct Associate Professor, Department of Biomedical Science, Daye University. Director Liu Poyi will share the topic on the Taiwan metagenomic mNGS multi-center clinical trials, interim report and case sharing. I think he is going to share on the topic of CNS infections cases. Let's welcome Dr. Liu Poyi.
Thank you for your kind introduction. Professor Zhang has been the role model of our fellow ID physician, and it's a truly honor to have been introduced by Dr. Zhang. And I have 20 minutes, so maybe we got to be hurry. And I have to apologize in advance because I have to go back to hospital for some unfinished business. So please feel free to interrupt me if you have any questions during the talk. And good morning, everyone. It's very exciting to have the chance to present of the interim report of the multi-center clinical trial in Taiwan. The trial is mainly focused on so-called CNS infection. It's the holy grail of any infectious disease. Why? Because it's really hard to know the pathogen underlying all these very different central nervous system. Sometimes it presents as meningitis, sometimes it presents as encephalitis, but all the same, it's very difficult to very difficult to truly know which pathogen underlying this infectious disease. So the study will be focused on the utility of metagenomic next generation sequence on the identification of pathogen related to CNS infection. So shall we start? Okay. Why is this important? Let's set the stage. Let's look about some worrying statistics. I think everyone can see very clearly from all the figures in Asia and Africa, near 10 million of cases are affected by CNS infection each year. These numbers are not just statistics, they are real people. So why is research is so important, especially in Asia Pacific region? So to identify the root cause of CNS infection remains a challenge. Even with advanced diagnostic technology, there are instances of cultural negative CNS infection. This underlines the need for more robust diagnostic methods, something our study want to address. So if we are on the same page, I think we can go to move on. Move on to the core of this study. The object, the study aims to compare the traditional method with mNGS in diagnosing CNS infection. Because we hypothesize that clinical metagenomics offers superior diagnostic performance. To test this, we have designed a multi-center prospective clinical diagnosis trial, something we want to prove that the clinical metagenomic is superior to so-called conventional diagnostic test. I believe the study could revolutionize how we diagnose CNS infection. So this cannot be done alone, right? We have many esteemed institutions and experts, and our teachers are collaborating with this study. This collective expertise enrich our study, making our finding more robust and also comprehensive. And the leading principal investigator is also my teacher, Dr. Wang Fuder, from Taiwan General Hospital, and their collective expertise greatly enrich our finding. So before we dive deeper, let's understand the study endpoints, which you can see in this slide. It's not about whether clinical metagenome work. We all know it works, but it's about how much better it can be done compared to traditional method. Of course, to prove this, we have to do some maths, right? We have to do some sensitivity, specificity, and predictive value to prove this stuff. So let's back to the benchmark. The study is comparing clinical metagenomics with conventional microbiology tests. This comparative approach helps us understanding how far we have come and what challenge remained. So the takeaway, in my point of view, is aim to demonstrate that clinical metagenomics can significantly outperform conventional technology in a various aspects. Before we jump to the result, I think it's a good idea to mention something about the inclusion criteria of a study. The quality study with a well-defined study population, it always starts from there. So the inclusion criteria are designed to ensure we are studying a representative sample. And because the more accurate our sample, the more reliable our finding would be. To ensure the validity of our study, the study team have set 4 specific inclusion criteria. The first one will be more than 20 years old, and we have to make sure it's clinical diagnosis of CNS infection. Some special marker we are looking including fever and CS vital pruritus and abnormal neuroimaging indicate pathological infection change. Of course, everybody have to say info consent. As important as the inclusion criteria, I think it's also essential to know who is not suitable for study. These inclusion criteria help maintain the integrity of this study by elevating variables that could screw the result. There's several exclusion criteria that include conditions like breastfeeding, pregnancy in female, someone who cannot have an insufficient vision or hearing, and in conclusion, clinical or laboratory findings. We also include participants for obvious contamination during sample collected and those with concurrent disease that could interfere with study. All of these are just to make sure the data we collect is as reliable as possible. And also we have a more experience study, something like drug abuse and psychiatric condition, as well as an exclusion criteria. All these length exclusion criteria that just want to make sure our data is not is as much as comprehensive, but also precise and reliable. Okay, let's move on to a study population and size. Okay, we will see more and more number in the following slides, so let's just get started. We are targeting a sample size of 80 cases that translate to a total of 116 tests. As each case will undergo both DNA and RNA testing. The specimen used for this test is CSF fluid. Okay, clarity is a key when discussed of endpoint. There is 4 scenarios in category of finding and helps not only to measure the efficacy of metagenomic, but also understand what scenario excel or possible for short. The first scenario will be mNGS result matching with clinical finding. The scenario B is clinical metagenome not only match with clinical finding, but also detect additional pathogen. The C case scenario C is metagenomic does not match with any clinical finding. And finally, scenario D is both mNGS and computer test return negative data. This scenario will help us better understanding the efficacy of metagenomic compared to traditional method. And we can see in totally 45 cases, the agreement of both positive is 11, and also both negative is also 11. That makes we will see in the next slide. Okay, before we move on, we can see this one, statistic difference in primary endpoint. And we can show we have got a pretty good p-value, which is below 0.02. That indicate our finding are statistically significant. The major takeaway of this study will be clinical metagenome detect more pathogen than any conventional method. I think it's a pretty good proof, and I think it's a great step for our Taiwan, both in the biotechnology and the clinical medicine. Okay, and you can see here, clinical metagenomic detect pathogen in more than 60% of cases compared to conventional method is below 40%. That means a difference of 20%, which is a lot from the significance of CNS infection. So we will go to the related clinical study and performance. I think this is a dialogue from the perspective of Taiwan and all the major players in this field. I think from our very esteemed speaker, the major player is always American and both China. And our period of less than 0.2 indicate our finding study significant and also valid approach, provide more confidence of this method. I think we are part of a larger scientific dialogue in the prospect of using of advanced sequencing technology in the diagnosis of infectious disease. A research paper in 2023 discussed the clinical application of the value of clinical metagenomic in the diagnosing of CNS infection. The performance suggests in this paper show a significant level of less than 0.1, which further validate our approach and the suggestion of high potential of clinical metagenomic in the field. Okay, we will move on to this one. And we will move on to the second endpoint and the diagnostic value metric. As you can see, because the both positive is 11 and both negative 11, as a result, we have exact same number of sensitivity and the negative predictive value. I believe because we are only halfway of the study, this may change after we correct all these 80 cases. But for now, I can see from the data, we can see that the sensitivity is good. As anyone knows, you use sequencing technology, of course, you detect more pathogen in this field. But I think the problem will be which patient truly get benefit from this kind of new technology. So, agent a scenario with where a transgenic culture method fail. That's all we encounter every day. You have a case with CNS infection. You give it everything you can with conventional test, and it's too often it turns out to be negative. So in this time is where the clinical metagenomic counts, filling the diagnostic gap. Our study highlights the potential in such challenging case. In this context, we are looking at the 45 cases at hand, where traditional method did not yield result, and 31 of them we use the clinical metagenomic we can have provide a possible diagnosis in this case. I think they highlight the potential of clinical metagenomic in case where the conventional method falls short. And of course, we have do some math in this one, right? And the most functional distribution is bacteria, fungi, and the virus. And I think this is something really interesting because I believe there is some microorganism there that could be detected by conventional methods. But as we all know, to vial a lab cell in the laboratory, this really condition depend. I think that's why nucleic acid test is still have its role in this kind of difficult condition. Okay, I think we have the end of our journey, and as we near the conclusion of the presentation, I would like to share some thought about this study. The data we have gathered is so far is promising and support the hypothesis that clinical metagenomics can be a powerful tool in diagnosing CS infection. But the truth is, while we still have work to do, the results indicate we are on the right track, and a further investigation is warranted. Okay, we have still 2 minutes, and thank you for everyone, and thanks for being here and joining us in this amazing journey. Thank you very much.
Thank you for kindly sharing, Dr. Liu Boyu. And we're going to save questions until panel discussion. And thank you.